All right, welcome back. So let's just jump right in with a big question. What if the most powerful things for our health have absolutely nothing to do with medicine? What if they're actually hidden in plain sight in things like how we plan our cities, our economic policies, or even the culture at our jobs? That's what we're diving into today, the EU's blueprint for building a genuinely healthier society. So let's get you thinking. I want you to really consider this. What affects your health more? Is it your doctor, who you maybe see a couple of times a year? Or is it your job, the place you go to every single day? And what about the air quality on your commute, or how secure you feel in your home? Which one really moves the needle? Well, the answer might actually surprise you. The evidence is just crystal clear on this one. Our daily environment, our day-to-day circumstances, those are the biggest drivers of our health. It means that policies on stuff like transport, housing, and employment, they're basically a super powerful form of medicine. They're shaping our well-being way, way before we ever even think about needing a doctor. Okay, so to really wrap our heads around this, we've got to kind of shift our perspective. We need to zoom out. It's not just about the choices we make as individuals. It's really about the bigger systems and structures all around us that are either helping us stay healthy or making it a whole lot harder right from the get-go. This whole idea is often called the social model of health. And you can think of it like ripples in a pond. Right at the center, that's you, your age, your genetics, all that individual stuff. But then the ripples spread out. The next layer is your social circle, your community. Then you've got your living and working conditions, and the biggest ripple of all, that's the large-scale economic and environmental stuff. Our health isn't just one thing, it's a product of all these layers interacting with each other. Okay, let's make this less abstract and more real. We're talking about really tangible things here. Like, is your housing safe and warm? Is the air you breathe clean? Is your workplace safe? It's about whether you have good people around you for support and if your job is stable. Heck, even our so-called individual choices are massively shaped by things like our income and education. See, these aren't just random details. They're literally the building blocks of our health. And here's the kicker. When not everyone has the same access to these building blocks, well, that's when you get what we call health inequalities. And look, these are not just random chance. They are unfair, and this is the most important part, they are avoidable differences in health between different groups of people. It's the tough truth that folks with a lower socioeconomic status just consistently live shorter, sicker lives. And that is the problem we absolutely have to solve with better policy. Okay, so if things like transport and housing policies are that powerful, how do we make sure they're actually helping, not hurting? I mean, what if we could sort of forecast the health consequences of a policy before it ever becomes law? Like a health weather forecast for new rules. Well, that's exactly where something called a Health Impact Assessment, or HIA for short, comes into play. It's basically a toolkit, a systematic way to look at a new policy or project and predict its potential effects on people's health. And crucially, it pays special attention to how those effects might be different for different groups. It really is like a data-driven crystal ball. And this isn't some black box process. It runs on a really clear set of values. It has to be democratic, which means involving the public. It's got to be equitable, so it's laser focused on closing those unfair health gaps. It's transparent, practical, and everything is based on the best evidence we have. These core principles are what make HIA such a trustworthy and powerful tool for making real change. Now, you've got to know, an HIA isn't a one-size-fits-all kind of thing. It's more like a toolkit. Just like a mechanic has a bunch of different wrenches for different jobs, there are different flavors of HIA you can use, depending on the policy you're looking at, how much time you have, and what resources are available. So on one side, you have what's called a desk-based HIA. Think of it as the quick and dirty version. It uses data that's already out there to give you a fast overview of the likely impacts. It's great for when you're in the early stages or don't have a ton of time. But then, on the other side, you've got the in-depth HIA. This is the gold standard. We're talking a comprehensive, deep-dive investigation that can take months and often involves collecting brand new data. It's what you'd use for really big, complex policies. All right, so we get the what and the why. Now let's get into the how. How does one of these things actually work? Let's break down the process. It pretty much boils down to 4 main steps. First up is scoping. This is where you plan the whole thing out. What are we looking at? What questions are we trying to answer? Step 2 is gathering. You collect all the evidence you can find from official data, scientific research, and, really importantly, from talking to people in the community. Step 3 is analyzing. You take all that info and figure out what the potential health impacts could be, good and bad. And finally, step 4 is recommending. You come up with real, practical suggestions to make the policy better for people's health. And one of the coolest tools they use in that analysis step is the Health Impact Matrix. So imagine you're looking at a new transport policy. This matrix lets you lay everything out super clearly. In one column, you've got the potential impact, like, say, improved air quality. Then you can mark whether it's a health gain or loss. And in the next column, you pinpoint exactly who's going to be most affected. It gives policymakers this incredible at-a-glance picture of who wins and who might lose out. So what can this health forecast actually tell us? Well, here's a really powerful example from a German HIA. They modeled what would happen if an employment policy shifted 15% of workers from permanent jobs to less stable fixed-term contracts. The result? They projected it would lead to an additional 400,000 people reporting that they're in poor health. Just think about that. That's a massive hidden health cost buried inside an economic decision. And that really gets us to the heart of what this is all about. This brings us to the real mission of health impact assessments. Because, you see, they're not just some technical, bureaucratic exercise. They're a tool for fighting for a fairer, healthier, and more just society.
The end game here, the ultimate goal is to build a fair society on purpose, by design. By being able to see these health impacts ahead of time, policymakers can actually write rules that actively help the most vulnerable people, that level up society and start closing those unfair gaps in well-being. At the end of the day, it's all about making sure that every single person has a fair shot at a long, healthy life.
So, I want to leave you with a question to think about. Now that you've got this new way of looking at things, this health lens, I want you to look around your own community. Think about the policies being talked about in your town or your city. What policy in your world really needs a health checkup? And more importantly, what can you do to make sure health is always part of that conversation?